anterior teeth with the H67 for calculus removal, first you need to find the correct end. If you fulcrum on a canine, check to make sure that you have the end where the terminal shank is more parallel to the long axis. This is the correct end. Your insertion point is at the midline. That means the tip should be at the midline. Using modified pen grasp, you apply short biting strokes, the tip third of the instrument, and wrist motion activation. You get to the line, stop, turn the instrument to move interproximal. At this point, you should see only the back of the instrument and not the side. Wrist motion activation can only be accomplished when all fingers in the grasp are touching. If you separate, you can only use digital motion activation. Using the tip third, you want to have directional pressure. You're pulling the instrument towards the tip and towards the tooth and rocking on your fulcrum. Your adaptation is tip third. That means you should see some space between the back of the instrument and the tooth. If the back of the instrument is this way, your tip is off the tooth. For the tip to go on the tooth, you must turn the instrument, roll the instrument so that tip third is on the tooth. Back is away from the tooth surface. Sometimes I see incorrect instrumentation where students are pulling the instrument out with their stroke. This is incorrect. Calculus, if it's present, is generally underneath the contact area. So you want your strokes to continue at least halfway across that interproximal surface. You also want directional pressure, so you're pulling towards the tooth surface, not just straight vertical this way, but actually towards the tooth surface. So if calculus is present, you will be successful in removing it. So you can see that directional pressure. You need moderate to firm pressure in your grasp. Pull the instrument towards the tooth, towards the tip. Wrist motion.
To sit at the towards position, so 3 o'clock, you first find the correct working end. So which one is more parallel? Obviously, this one. So you are going to fulcrum on the opposite side so that you get that lateral pressure, so that as you're working towards the towards, you get that pressure and it helps propel you this way. Insert at the midline. Start to roll yourself around using your fingertips. Keep rolling, keeping that 1/3 tip adapted the whole way, all the way till you get right underneath the contact. Then you will sit at 12 o'clock, flip your end, insert at the midline. Remember, this is a sickle scaler, so we can go slightly below the gum surface. And we're going to roll, 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 roll. As you get here, you can come out. You can reinsert and then make sure the back of the instrument is facing this way so that our tip stays adapted. If you're not turning and rolling and adapting, your 1/3 tip will not be on the tooth and you will be out into the gums and your patient might cry. All the way up underneath the contact. Now look at my angulation. Remember, when we think 70 to 80 degrees, if this were 90, we want to lean into the tooth, like this so we get that cutting edge onto the tooth as we come around. Having the 70 to 80 degree angle will help you be successful in your calculus removal with short biting strokes.